Okay, greetings. So my name is Vijay. So today we are going to look at tetralogy of fallot. So tetralogy of fallot is the commonest cyanotic heart disease. So tetra refers to four. So therefore it has four features, which is ventricular septal defect, pulmonary stenosis, right ventricular hypertrophy, overriding aorta. Okay, first is pulmonary stenosis, which means the valve over the pulmonary artery cannot be opened completely. So the heart needs to work harder in order to pump the blood via the pulmonary artery. So in order, since it's opening the pulmonary valve forcefully, it produces an ejection systolic murmur and a single S2 sound. Since the pulmonary valve is not opening completely, the right outflow tract is obstructed. So the pressure in the right ventricle increases. So in order to compensate the high pressure, the muscles over the right ventricle become larger and become more muscular. Therefore, the right ventricle become hypertrophic. This hypertrophic gives the characteristics of boot shape in the chest X-ray. Third is overriding aorta. So the normal location of aorta should be in the left ventricle, but the overriding aorta refers to the aorta located between the right and the left ventricle, between RV and LV. So thus the blood from the right ventricle enters the aorta. Oxygen poor, blood enter aorta. The fourth one is the ventricular septal defect. So the ventricular septal defect allows the mixing of blood between the right ventricle and left ventricle. Since the pressure in the left ventricle is higher, the blood flows to the right ventricle, and this equalizes the pressure between right ventricle and left ventricle, and thus less oxygen is supplied throughout the body. Thus the body becomes bluish color, also known as cyanosis. Okay, so this long-standing cyanosis leads to finger clubbing and polycythemia. Okay, now let's see how heart failure occurs in the tetralogy of fallot patients. So there is right ventricular hypertrophic, right? So this right ventricular hypertrophy is more prone to get ischemia. So this ischemia can cause systolic dysfunction. At the same time, there is small volume of blood is pumped from the right ventricle. So this causes diastolic dysfunction. Both the dysfunction leads to heart failure. Okay, these are the investigations be done in the tetralogy of fallot patient. First is the chest X-ray. So in chest X-ray, we can see a boot-shaped heart and also oligemic lung features. And the next is the electrocardiogram. So in the electrocardiogram, there will be a right axis deviation and right ventricular hypertrophic pattern. And the third one is the echocardiogram. In echocardiogram, we should see the ejection fraction and also the anatomy of the heart.
Okay, now let's look at the management of the tetralogy of fallot. First, the definitive treatment for the tetralogy of fallot is the Blalock-Taussig shunt.
Okay, Blalock-Taussig shunt is actually a surgical procedure, and in this procedure, we actually create a anastomosis from the subclavian artery to the pulmonary artery. So this is our aortic arch, right? So the first one is the subclavian artery. So we create a anastomosis between the subclavian artery and also the pulmonary artery.
Okay, this surgical procedure is actually increase the pulmonary blood flow distal to the right ventricular obstruction. At the same time, it also reduces the cyanosis.
Okay, there is medical emergency in tetralogy of fallot heart disease, which known as hypercyanotic spell. So this hypercyanotic spell is also due to the sudden pulmonary infundibular spasm. So when there is a sudden contraction of the muscles over the pulmonary valve, so it increases the right ventricular shunt from the right ventricle to the left ventricle. So these will worsen your cyanosis.
So in hypercyanotic spell, since there is less oxygen is supplied to the body, so we must administer 100% oxygen. Then put the patient in a knee chest position. Why? Because give a calming effect and increase the systemic vascular resistance. And this systemic, since the SVR increase, it reduces the right to left shunt. Then administer IV morphine, because this morphine reduces the distress of the baby. Fourth, since this is due to the infundibular sudden spasm, so we should treat the spasm also. Therefore, we should administer IV propranolol, reducing the spasm. And then give volume expander. It can be crystalloid or colloid, and this volume expander will increase your preload. Okay, so the body, since there is less oxygen is supplied to the baby's body, therefore the aerobic respiration will be converted into anaerobic respiration. So in order to reduce that effect, we must give intravenous sodium bicarbonate, which reduces the metabolic acidosis. After that, give the patient prepare the patient for emergency Blaylock Taussig shunt procedure. Thank you.